Tricep reflex intact, noted by contraction of the tricep muscle. Again on this side. Good. Tricep muscle of the left arm intact, noted by contraction of the tricep. And then we're just going to check your bicep here. Good. Bicep reflex intact, noted by flexion and contraction of the bicep muscle. Check your left arm here. Good. Left bicep muscle intact, noted by contraction and reflex of the bicep muscle. Good. Popliteal reflex felt, indicated by flexion of the lower leg, and again. Good. Popliteal reflex intact, indicated by flexion of the lower extremity on the left leg as well. Going to check the ankle here. Good. Achilles tendon intact.
Then next I'm going to check your reflexes.
Okay.
I promise you I will not hurt you.
Okay.
Okay, so let's start up here. That's bicep. Okay. And then right here. Good. And then we will do your brachioradial. Great. And then on this side, your bicep. Good. And then your tricep. Great. And brachioradial. Great. That is good. Then I'm going to check your reflexes. Right below your patella, this is your patella reflex. Great. And then on the other side. Good. And then we'll check your Achilles. Just hold your leg. Great. And on the other side. And good. I'm going to look under your feet. Good. I do not see any lesions there. And I'll check for a reflex called Babinski. And that is good. Your toes are not flaring. Okay. And then on the other side, your feet looks good. And great. So all your reflexes are intact.
I do biceps, brachioradialis, triceps, knee, and ankle. When I do the ankle, I slightly dorsiflex the foot to get a better reflex. I grade deep tendon reflexes from 0 to 4, 0 being absent reflex, 1 is decreased reflex, 2 is normal, 3 is hyperreflexia, 4 is clonus. Now we'll do the pathological reflexes. The best way to do Babinski is use a semi-sharp object and go along the outer aspect of the foot to the ball of the toes.
Next, I'm going to do your deep tendon reflexes. I'm going to do your brachial. I'm going to relax your arm for me. Okay, that's good. Your tricep. Okay, that's good. Next arm. Good. Going to do your patellar on both of your knees and your Achilles. Okay, good.
I'm going to also check reflexes, and we'll start down here since the camera's already down here. I'm going to do her knee with the patellar reflex. Just relax your round legs for me. Good. And then on the Achilles, just relax your hand in my foot here, or your foot in my hand here. Good. Good. And let me bring this back up a little for you. Okay. And then I'm also going to check her brachioradial reflex here. Good. Good.
Now I'm going to check your reflexes. So I'm going to start with your brachioradialis for C5, C4, or sorry, C5, C6. So just put all the weight on me and relax, okay? Okay. And now for the biceps, put all the weight on my arm and relax. Okay. And that was for C5, C6 as well. And the triceps for C6, C7, C8. Good. And then we'll do this side. So the brachioradialis, just relax and put all the weight on me. Good. For C5, C6, and then the biceps, there you go, put all the weight on me. Okay, for C5, C6. Good. And triceps for C6, C7, and C8. Good. Now I'm going to do the patellar for L2, L3, and L4. Okay, and Achilles for S1, S2. Okay, and then the plantar for S1, S2, L4, and L5. Alright, and the patellar over here, so L2, L3, L4, and Achilles, S1, S2. Okay, and plantar for S1, S2, L3, L4, and L5. Okay.
Do some of your reflexes, so I need you to relax your arm on top of mine. Okay. Same thing. Test a few more reflexes. Just relax your leg for me. Good.
So next thing we're going to do is check her reflexes. Just relax it right in my hand. Good. Good reflex there on the right biceps. Good reflex on the brachioradialis. And good reflex on the triceps. Now this is the problem arm, so we'll see if this one's different. Much lower reflex. So that side is +2 equal and active. That was a good one. And that was a good one. So she does have a C6 nerve problem here.
Now I'm going to test reflexes. And we'll start with the biceps. And again, just let your arm just rest right there. The triceps. And let me just support your wrists here in the brachioradialis. And over here. Again, just relax. Biceps, the triceps. Let me just support your wrist. The brachioradialis. Good. Okay, just let your fingers rest against my fingers. And we're going to test the same thing over here. Okay, good. We're now going to test reflexes and start with the knee jerk. Just relax totally. And here to the other side. Good. And we're going to now test the ankle jerks. Just relax. Just totally relax. Position it. Good. And we're going to try the other side. Again, just totally relax. Very good.
The biceps tendon can be localized in the antecubital space, and it dives medially here. And the way you localize this is you can feel and have the patient flex their arm, and you should feel the tendon itself pop up right in this area. Push firmly with your thumb or your finger right over the tendon, and you're using the small point of the reflex hammer to strike your own finger, and you should see flexion of the arm and contraction of the biceps muscle. If you're having trouble with this, it's important to make sure that you're localizing the tendon properly. Press firmly over the tendon with your finger and strike firmly over the actual bone of your finger. So the brachioradialis reflex can also be elicited from this position. So the target to strike with the flat end of the reflex hammer is a few inches proximal to the distal radius, just overlying the radius. And this one can be very difficult to elicit. So if you have them extend their thumb like that, and you should feel the muscle and the tendon pop up. And you just strike right over the radius, and you should see a slight flexion of the arm, often seen as kind of a flicker of the thumb. Another way to do it is similar to the biceps reflex, is to firmly place your finger over the area of the tendon and then strike your finger. And you should see a flicker of the hand there. The triceps tendon extends from the triceps on the posterior arm and then inserts over the olecranon. So the best way to localize this is to just feel the proximal borders of the olecranon, and you can have the patient extend their arm, and you should feel the triceps muscle and the tendon move there. Localize the tendon, and then use the small point of the hammer. You strike that, and you should see contraction of the triceps muscle as well as extension of the arm. Alternatively, another way to do this is to have the patient's arm totally limp so that you're taking all the weight, and you're striking in the same area again, so just proximal to the olecranon, and you should see extension of the arm and contraction of the triceps. Use the small point of the reflex hammer to strike the tendon, and you should see extension of the knee and contraction of the quadriceps muscles. It's often useful to keep your hand on the patella itself to make sure you're not striking the bone, as this can be uncomfortable for the patient. The Achilles tendon extends from the gastrocnemius and soleus muscles of the calf posteriorly over the ankle and inserts on the calcaneus of the heel bone. To localize the tendon and the target for the reflex, you can feel the bony borders of the calcaneus, and just proximal to this you should feel the tendon itself. And to make sure you're in the right spot, you can ask the patient to plantar flex his foot, and you should feel this tendon move. So to actually elicit this reflex, you want to have the patient totally relax his leg, and you apply slight dorsiflexion with your hand. And then using the flat end of the reflex hammer, you strike the tendon, and you should feel and see plantar flexion of the foot as well as contraction of the calf muscles. A possible normal variant in elderly patients especially is to have a reduced or even absent Achilles reflex. One simple but very common reason why some students have difficulty eliciting the responses is that they're simply not striking hard enough. So it's important that you practice the actual swing to make sure that you're actually causing sufficient stretch of the tendon to elicit the reflex arc. Another very common reason why sometimes it's hard to get good response is that the patient is not fully relaxed. And you can use a technique called reinforcement to help the patient relax and get a better reflex response. If you're getting reflexes in the lower extremities, one way to do this is to ask the patient to clasp both hands like this and then pull while you're eliciting the response. So they're having kind of an isotonic contraction of the upper extremities while you get a reflex in the lower extremities. If you're testing in the upper extremities, one common way to do this is to ask them just to clench their jaw as you try to get a reflex. So could you please clench your jaw for me? And it distracts and helps relax these muscles so you can get a good response that way.
Be testing the reflexes in the arms, so just give me all your weight. There we go. Not super duper reactive, but relax your fingers. Draw something in this hand. Tell me what I'm drawing.
3.
Okay. And over here, relax for me. Some reflexes aren't super duper brisk, but is that normal for you?
I don't know.
Okay. Same thing, I'm going to draw something in this hand. It's a number.
1, 7.
Correct. Close enough. 1, 7. Similar structures. Okay, uncross the legs for me. Binsky.
And we'll start with biceps reflex. I tense the tendon and obtain that reflex. So C5-6 reflex, brachioradialis, more C6, triceps C7. They're often mixed a little bit, 6 and 8 in there. And I'll work down patellar reflex, L2, 3, 4, probably more 3, 4. Achilles, primarily 1, maybe some adjacent roots as well. Then I'll do plantar response, looking for that Babinski response. Hers is normal. Check clonus with an abrupt pull-up of the foot. And I'm looking for 1 or 2 beats is normal. You get into the 4 to 6 or sustained category, then that's abnormal.
You can check your reflexes here. So just relax your arm. Great. Okay. 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 And usually I would compare bilaterally for this exam, but for sake of time, I'm just going to do one side.
Okay. Please swap over. Okay. And again, raise your thumb for me. And relax your hand. Completely relax. Okay. That's great. So do the same here as well. Just press down. Just relax for me. Okay. We'll check the other side. Just relax it. Okay. Great. And now what I want you to do, just give me the full weight of this hand. Just completely relax your hand. Completely relax. Okay, that's great. Just completely relax and take the full weight. Just gonna lift this leg up. Okay, and if you just relax your feet completely. I tap down the hammer. Okay, and the same on the other side. If you just relax your legs for me, let me take the full weight. Relax your foot. There we go. That's great. What I want you to do is just bend this knee for me, and just rest this leg down this way. There we go. Right. Relax. I'm just going to push your foot up, okay? It shouldn't be painful at all. If it is, let me know. Just completely relax. Let's try that one again. Relax. If you just relax your feet for me, and tap just on your heel. That's great. Relax that leg for me. We can do the same with this leg. So again, bend your knee, rest it towards the side. Okay. Again, I'm just going to move your foot up. It shouldn't be painful at all.
Okay.
Just relax your leg for me. Try that again. Okay. Just going to check for the reflexes. So, bring this up. Just going to tap on the back here. Okay, that's great. If you can you straighten your legs for me. I'm just going to check the reflexes underneath your feet.
Okay, just relax your arm in my hand here. Biceps is fine. Brachioradialis is fine. Triceps is fine. Oop, there's a problem. Just relax this for me. There we go. We like to have fun in here too. There we go. Now your left reflexes weren't as good as your right ones. Just let your legs hang. Got a little bit of a reflex on the right patellar and a loss of the left patellar reflex in comparison. Feel that one jump a little bit, and that one just barely does anything. So relax your foot. Let me hold it. This is the Achilles reflex. Just relax this foot. Okay, a very low reflex on that as well.
And we'll go ahead and test your deep tendon reflexes. So I just want you to relax the best you can here. Just kind of let your arms float like this. Good. Biceps. Good. And relax. Brachioradialis. Good. And triceps, this one you really got to hang on my arm here. Just really relax. Good. Good. On the other side. Good. Now your patellar reflex. Just relax. There you go. And Achilles, relax. Now I'm going to test your Babinski. This might be a little uncomfortable, okay? Let me try that again. Okay. I'm going to test ankle clonus.
But now we're going to check his reflexes. In his right biceps first. Good. Brachioradialis, good. And triceps is good. Those are all +2 equal and active, which is normal. Good. Biceps, good. Brachioradialis, and good triceps. And there you got good patellas. Now you know why I don't ever stand out in front of people when I do those. There we go. Good. That's it. So he's got good Achilles reflexes as well.
So what we're going to do next is your reflexes. You can just relax for this. It's not bad. Ready? Okay. Relax your hand. I'm just going to hold it. Okay. All right. Again, relax. I'm just going to hold it. Okay. On this side. All right, perfect. Your reflexes are there.
So next thing we're going to do, we're going to tap on your reflexes, okay?
Okay.
This feels kind of funny and weird. So, okay, here we go. Just let everything go loose. Okay, we're going to tap up above your elbow here. Okay, same thing here. Let it relax. All right, and we're going to tap here by your wrist. And here. And now we're going to move to your legs. We're going to tap by your knees. All right, let everything go loose. Great reflex. They're all present and symmetrical. And we're going to tap by your ankle here. I'm just going to turn your leg out a little bit. You're great. Terrific. Okay, and on the left. Just let it go loose. Let me do all the work. Excellent. Okay. And I'm just going to scrape the bottom of your foot a little bit with my stick here. Here it comes. Hang on. All right.
We're going to do tendon reflexes with the reflex hammer now. Okay? All right. All right. So first thing we'll do is go ahead and check here in this area, your brachial. All right. I'm going to actually tap my finger. See if you know. All right. Try one more time. Okay. Good. All right. Do your tricep now too in this area. So you hold your arm there. Very good. And, all right. Very good. Check this area as well. Okay. All right. Good. All right. We'll move to the other side. We'll do the arm as well. Brachial again. Very good. Okay. And then you pull your arm out again like that. All right. Gently arm. Get myself that time. All right. Okay. So this time, well, we'll have you sit on that side of the bed, dangle your legs over the edge.
Okay.
And just relax them, okay?
Okay.
There. Okay, good. Okay, very good. All right. I'm going to tap on the back of your ankle as well now. It's just your Achilles. Good. Other side, just staying relaxed. All right.
So, that's his biceps reflex, and you probably saw that. Now watch his fingers and hands here. Excellent reflexes there. And we got a good triceps reflex. So we're seeing on this one that the C6, C7, and C8 nerves are all doing very well. Oh, there's a problem. No reflex there. Alright, see, we like to have fun doing this stuff too. Yeah, he's got good patellar reflexes. That's why I don't stand out in front of the patients when I do this. I did this on an elderly Medicare patient one time, and I was standing in front right after I got out of chiropractic college, and she had a hyperreflexia and kicked me right in the groin, so I haven't done it since then.
I'm going to test your reflexes. You could just let your arms be loose and by your side. Just let your arms just drop down. Very good. Okay, just let your legs be nice and loose. And test your ankles.
What I'm going to do now is gently check your reflexes, if that's okay.
Yeah, fine.
What I want you to do is relax your leg down on my arm and let me take the weight of it. Okay? And relax and let me take the weight. Thank you. And relax the leg down, and the same on the other side.
Yeah.
Thank you. That's thank you. And let me take the weight. That's great. Thank you. Good. On the count of 3, can you clench your teeth together for me?
Yeah.
Thank you very much. 1, 2, 3. Thank you. That's great. Nice and relaxed with the ankle now for me. On the count of 3, clench your teeth for me. 1, 2, 3. And again, 1, 2, 3. Thank you. And the same with this foot. Nice and relaxed for me. On the count of 3, clench your teeth. 1, 2, 3. 1, 2, 3. Thank you very much.
And so starting with the biceps reflex. And some people don't have the briskest of reflexes. Just relax there. And to bring it out, I can feel it there. I can feel the muscle. Can you clench your jaw? Clench your jaw hard. And that tends to bring it up a bit more. Good. And then the brachioradialis is here. Great. There. Great. And then the triceps. And there's a few ways to do the triceps. I'll do this arm first. Okay. And just let it drop down like that. Which doesn't always work for some people. Other ways, just let your arm drop, please. Let me hold it up. Good. Okay. There we go. Now I'm feeling it a bit better. There we go. Good. So the two main reflexes are, of course, the patella. Okay. And although you could tell his reflexes are a little brisker in the lower compared to the upper, but that's fine. It's just more if they're asymmetric. And then moving down here, lifting his leg up for the Achilles. And that's good. I'll move over here. And it's good. And then what we can also do is the Babinski, where we actually scrape this at the bottom. And we're just going to scrape it along there. And he retracts a bit, but he doesn't do the positive response, which is the toe going up.
First thing I'm going to do, I'm going to test over here. Okay. Okay. Just leave your hand right here. Okay. And come over on this side. Okay. Put you right here. And just leave your hand here. Okay, that's perfect. Let me check your knee. Okay. Put your Achilles. Alright.
And then bend your knees up a bit, same amount on each side. Okay, put that leg down, bend this one, that's it, let it flop towards me. Same on the other side.
Her reflexes are +2 equal and active. Okay, just relax that. There you go. There we go. Good. Yeah. Okay, yeah, there you go. Oops. There we go. That's it. Her upper and lower motor reflexes are +2 equal and active.
So I'm going to be using this. It's called a tendon hammer. I'm going to be pressing out. I'm going to be tapping this at various muscles. It shouldn't feel, you shouldn't feel any pain. But if it's uncomfortable, please let me know. You might just feel a sort of tingling sensation. So if you could just completely relax for me, and then you could just fold this across your lap like that. Okay, be tapping it. Okay, that's fine. And if you could just fold this across again, just completely relax for me. That's fine. And if you could, I'm just going to be tapping your forearm as well. So again, just completely relax for me. Okay, that's fine. And just here. Okay, that's fine. And I'm just going to be hitting at the back of your arm as well. So if you could just let me take the weight of your arm. Okay, that's fine. Could you just clench your teeth, and I'll count down to 3, and then I'll tap. So clench your teeth when I say 3. 1, 2, 3. Okay, that's great. I'll do the same again here. Okay, that's fine.
I'm going to put my hand underneath like this. Just going to do, if you lift your legs up. Okay, thank you. Same with the other leg. Okay, thank you very much. And now, can I ask you to cross your leg? Sorry. Are you okay? Okay, that's all right. I'm just going to tap over here. Okay, same with the other leg now. Okay, thank you very much.
Open your jaw slightly for me. I'm just going to be tapping this lightly with this tendon hammer here. If you feel any pain, please let me know. So we just... Okay, that's brilliant.
I'm now going to test your reflexes. Allow me to position your arms like so. I'm going to begin by testing your biceps reflex. Now we'll move on to testing the knee reflexes. And finally, the ankle reflexes.
Now I'm going to check the reflexes, okay? It's not going to hurt it. We can do arm slightly. Thank you.
And I'm going to test your reflexes. So again, really nice and relaxed and floppy. I'll take the weight of your leg. Just get you to clench your teeth for me. Just clench your teeth. Okay. All right. Thank you.
Can you clench your teeth together tightly for me? That's marvellous. And now relax your jaw open and let your mouth hang open a little floppy. That's it. Don't force it out though for me, Mr. Foot. That's it. Lovely. Nice and relaxed. Thank you.
Let's take a look at your reflexes here. You just try to relax. Relax. Okay.
So with your sitting there, I'm just going to tap your arms. Okay, so if you go nice and loose for me. Okay, and go nice and loose on this side, lovely. Okay, if I could get you to swing your legs around for me. So next thing we're going to do, I'm just going to test your reflex. That's all right. So 1, 2, 3. 1, 2, 3. There we go. And 1, 2, 3. Okay, that's lovely. Get you to kneel on the bed like so. We're just going to test your ankle reflexes now, so stay nice and relaxed for me. That's lovely, thank you.
So we'll start on the left and then we'll go to the right, okay? First we're going to check. Go ahead and relax and I'll hold your arm here. I'm just going to hit my hand. Okay. And you're going to see your bicep. See how it flinches there? Okay. Tricep flinch. And brachioradialis makes your thumb jump. Okay. Good bicep reflex. Good tricep reflex. I don't know if you can see that from over there. But watch her tricep jumps. See how it jumps right there? Alright. You can tell that you work out. And good brachioradialis. Okay, next we're going to do your knees. Okay. This is your patellar. Have you had any problems with knee injuries? No. Okay. Go actually scoot your butt back a little bit because we're going to have your legs kind of dangling. Okay? Good. Very good. On this part, I apologize, may tickle a little bit. I just want to see. Okay. Must not tickle at all.
Check your reflexes here now. You just relax that. There you go. Oh, there's a problem.
Is it really there?
No, I'm just kidding. We like to play around here and have fun, especially after hours. Okay, relax your leg. There you go. This is why I don't stand out in front of people and lead. Okay, just let your ankle relax. There you go. Yep. Just let it relax. I got it. There you go. Better.
You just put your hands down, drop your elbows, let them go loose. And I want you to clench your teeth for me and let them go loose. Same on this side, clench your teeth and let them go loose. And then the reflexes. I tend to do the reflexes now when he's nice and relaxed, even though the textbooks will tell you do power next, but I already know about power because I've just examined him walking. So we compare the sides. Again, ideally we'd expose the muscles so that we can see them, but certainly the reflexes are normal. Just relax your leg. There we go. Just relax it. Again, a bit on the brisk side because it's a Saturday morning and he's being examined on camera when he'd rather be at home watching the telly. Is that true?
They're always brisk.
They're always brisk, okay. And then let's not forget the planters. Little scratch coming now. Okay. Do that one again. Okay.
I just need to do your reflexes, if that's okay.
Yeah.
Gently tapping you with a hammer. What I want you to do for me is rest your leg down on my arm. That's it. And let me take the weight of it. Relax it down and let me take the weight. Thank you. Thank you very much. And the same on this side. Again, let me take the weight. That's fantastic. Thank you very much. I'm just going to hit my own hand now. Thank you. And relax your foot for me, nice and floppy. Just let me gently hold it back. Thank you. And the same on this side. And gently hold it back. Thank you. This is a little piece of plastic, just going to along the bottom of your foot. Okay?
Okay.
Thank you. Okay, thank you very much.
Scoot back just a little bit so your shoes aren't quite out there. There you go. Perfect. Just like that, nice and loose. Okay, good. Now, stare at the edge of that picture and don't blink as I tap your forehead just with my finger. Keep staring there. Okay, now, here, feel this first, Pat. It's a little bit, it's not sharp, but it's rough, right? I'm going to stroke your palm like that. Look at that. Don't pay any attention to what I'm doing. Same thing here. Same thing here. Okay, good. Now, I'm going to tap my finger. Just let your jaw hang, just like that. Very good.
Just relax. Just let your arms go loose. The triceps, again, just a little floppy. That's super. Just let your legs go all floppy. Just flip your legs out. It's like a rectangle, that's the bottom of the rectangle, that's the top of the rectangle. That's the top of the rectangle, that's the bottom of the rectangle. That's fine.
So I'm just going to test your reflexes now. So I still want you to go lovely and floppy, and I'm just going to use this. It doesn't hurt. So try and relax. And the other side. Okay, and relax. Brilliant.
Okay. I'm just going to tap on some of your joints now, so if you just stay nice and relaxed, let me take all the weight. Good. Can I ask you just to clasp your hands together for me? And when I say pull, just pull together. So relax and pull. And relax and pull. Just relax to begin with. And when I say pull, pull. Pull. And this side. Relax to begin with. Pull. And relax.
So I'm going to take some of your reflexes now. Okay? If you could just put your arm like this. And this. Great. Up. Thank you. In here. I'm going to do to your knees, right behind your ankle. Great.
So we do muscle tests and also reflexes, upper and lower. He's had x-rays taken and hasn't had any recent trauma. He's under regular chiropractic care, so I'm not going to do a full-blown comprehensive exam on him. But I do always examine patients according to their needs. Reflexes are +2 equal and active, upper and lower.
I'm going to check your reflexes, so just relax. Relax.
Can you please let your arms relax in your lap? I'm going to test the biceps reflexes. Brachioradialis. Triceps reflex. Let your arm relax. Patellar tendon reflexes. And Achilles tendon reflexes. Drawing it straight from the heel along the sole of the foot in an arcing motion towards the toes. And observe the first movement at the proximal joint of the great toe. The normal response is flexion. Extension is the abnormal response, also called the Babinski sign.
Okay, so just have your arm relaxed. I'm sorry. Great. Great. Perfect. Just relax. Okay. Okay. Perfect. Okay. Stand on the side of this one. Okay. Great.
Next, we're going to percuss. Let me know if any of this hurts, okay? Alright, no pain there?
No.
Alright, next we're going to check for CVA tendons. I'm going to do the same thing, and I want you to tell me if you feel any pain, okay? Just relax your arm on mine. There you go. Okay, and the other side. Both tricep reflexes are equal on both sides. Next we'll move into the brachial. So just relax your arm right there for me. Alright, and this side. Alright. Brachial reflexes are equal on both sides as well. And we will go ahead and move into the radial.
and radial reflexes are equal bilaterally as well. It's kind of less for any differentiating sounds. Any pain whenever I do this? Good reflexes there, equal on both sides. And now for the Achilles, just gonna hold your foot here. All right, and this side. All right. Equal reactions on both sides of the Achilles. Both her feet tended to go down whenever I struck her Achilles.
Just stay in your arm, relax your arm. I just need you to relax your arm. Excellent. Okay. Just gonna hold your arm out like this. Okay. Just need you to relax your leg.
So first your brachioradialis. So can you relax your arm for me? That's C5 and C6, and relax. And the bicep C5, C6. Alright, I'm going to do your triceps, C6, C7, C8. Alright, patellar, I'm going to push this in. This is L2, L3, L4. Okay, and Achilles S1, S2. And plantar, which is S1, S2, L4, L5.
I'm going to lift this up just a little bit. Good.
Okay, move your arm just a little bit. Perfect. Thank you. Okay. Your aorta was also very strong when I was listening.
So in the lower limbs, again, you can do this with the patient seated. So let your legs dangle there, okay? So that's a knee reflex. I would usually just come down. Now again, if you're sitting, nice big swing, and you get the tendon reflex. I hope you haven't been injuring your knee there, okay? You could also just support the knee like that, tendon hammer like this. There's the patellar tendon there. Nice firm strike. Again, nice firm strike. If you do this sort of thing, you're not going to get a tendon reflex, okay? The ankle jerk, when you're doing the ankle jerk, just bring your toes up hard as you can. This tendon here is your tibialis anterior tendon, okay? Now if that tendon is contracted and I try and do an ankle reflex, nothing happened because that's the antagonist of the Achilles tendon. So what you've got to do is relax the ankle, and really without letting the patient know you're doing it. You want to gently put a bit of tension in the Achilles tendon, and then again let your hammer swing to get the reflex. It's also perfectly legitimate to do a plantar strike, where you put your fingers at the sole of the foot, slowly stretch the Achilles tendon, and then smack the reflex like that. Because that does the same thing, it creates the acceleration force in the Achilles tendon muscle spindles that generate the reflex. Same again here, so again you can passively dorsiflex the foot. I used to say the tibialis anterior tendon is the enemy of the ankle jerk, so it doesn't really work if the foot's actively dorsiflex. If you passively dorsiflex and strike, you get an ankle jerk. So that's how you do the ankle and knee reflexes.
Test the biceps reflex with the patient's arm in her lap. Palpate the biceps tendon with your thumb and strike your thumb, not the tendon itself. Look for flexion of the forearm. Test the triceps reflex with the patient's elbow held suspended in your hand. Encourage her to let the arm hang limp. Palpate the triceps tendon with your thumb and strike your thumb. Look for extension of the forearm. Test the brachioradialis reflex with the patient's arm in her lap. Palpate the brachioradialis tendon with your finger and strike your finger. Look for contraction of the muscle, sometimes with upward angulation of the hand. Test the patellar reflex with the patient sitting on the edge of the bed. Palpate the patella and the patellar tendon below it. Strike the tendon directly or tap over your thumb. Look for extension of the lower leg. Reinforcement may help when reflexes are hard to elicit. Have the patient clench her hands together and pull hard while you test the reflex. Test the ankle jerk reflex with the patient sitting on the edge of the bed. Tap the Achilles tendon with the hammer and look for foot flexion. If you place your hand underneath the foot, you may feel subtle flexion that cannot be seen. It may be easier to elicit this reflex with the patient kneeling on a chair. If the patient can't sit, lower extremity reflexes can be tested with the patient supine. Test the jaw jerk or mandibular reflex by placing your finger or thumb on the chin and tapping it. Look and feel for slight jaw contraction. Test for the palmomental reflex by scraping the thenar eminence with the end of your reflex hammer. Look for contraction of jaw muscles or twitching of the lip. Test the plantar response by scraping along the lateral border of the sole and across the toes with the end of the reflex hammer. Extension of the great toe, called the extensor plantar response or Babinski sign, is abnormal. Withdrawal or toe flexion is normal. The Chaddock and Oppenheim reflexes look for the same extensor response, but are less likely to cause withdrawal. For the Chaddock reflex, the stimulus is a scrape along the side of the foot from the lateral malleolus to the toes.